Good morning.
Morning.
Hey, how are you?
Good.
I'm Joseph. I'm going to be doing your assessment.
Okay.
Tell me your full name
Faith Mitchell,
and your date of birth.
11/24/56.
Well, what would you like me to call you? Faith? Okay, Faith, what brings you to the office today?
I recently moved here and I need a new healthcare provider.
Okay. Today I think what we'll do, I think we can do that for you. I think what we'll do today is we'll do an assessment specifically on your abdomen. We'll listen to it. Are you having any abdominal pain right now?
No.
Okay. And then we'll go ahead and do your musculoskeletal system. We'll look at your muscles, bones, joints, see if there are any deformities there. Okay.
Okay.
Are you having any joint pain?
No.
Is there any reason that I wouldn't be able to do, bend and flex your knees or anything? Okay. And are you having any pain in your muscles?
No.
Okay. Do you have any allergies?
No.
Okay. Do you have allergies to medicines?
No.
Okay. Any latex allergies?
No.
No. Okay. And if you'll do me a favor, go ahead and hop up off the table and take a walk to the door and take a walk back. Okay. Go ahead and hop up on the table. And go ahead and lay back for me. And I think we'll start with the abdomen. And just as of note, her gait was steady. She was not favoring one side or the other. She didn't have a limp to one side or the other. The feet were straight out in front of her. They're symmetric. She had an equal bearing of weight to one side or the other. There are no gross deformities. I didn't see any atrophy of muscles in the legs or the hips or the thighs. Her head remained midline over her cervical spine. As far as inspection of the abdomen is concerned, there is no abnormal venous pattern noted. There are no protrusions, the obvious protrusions just on inspection. The skin color looks pink, and tangential lining shows me that there are no abnormal pulsations in the abdomen. There are no obvious masses. So we'll move on to auscultation. For purposes of this video, since we're limited on time, we'll just say that I've auscultated all four areas, the right upper quadrant, left upper quadrant, left lower quadrant, and right lower quadrant. What I'm expecting to find in auscultation is normal active bowel sounds. I should not hear hypoactive or hyperactive. If I were to find an area that I felt like there were no bowel sounds, I would listen for a total of 5 minutes to confirm that. In each quadrant, normally I would just listen for 1 full minute. Again, for purposes of this video, we won't be doing that. Then I'll go to the epigastric area, which is right under the xiphoid process, listening for an aortic brewery. I will go ahead and say there's not one, and that her bowel sounds are normal active. 2 to 3 centimeters above the umbilicus to the right and the left. I would listen 2 to 3 centimeters out from that at the renal arteries, and I'm listening for a brewery. I'm going to say I don't hear that on either side. The iliac arteries are 2 to 3 centimeters below the umbilicus, 2 to 3 centimeters on either side. I'm going to go ahead and say that there is not a brewery for that. And then I would also auscultate the femoral arteries as well during this, but for time constraints, we won't be doing that today. I'll go ahead and palpate right above the epigastric area, right below the epigastric area at the aorta to see if I can feel the pulsation of the aorta, which I do. It feels regular in rhythm, and then I will go ahead and percuss. And I should hear areas of tympany. I will percuss the entire abdomen, but for, like I said, time constraints, we won't be doing that. I will try here on the left upper quadrant, mid-clavicular line, 5th, 6th intercostal space. I'm going to go ahead and percuss. and see if I hear dullness, which would indicate the spleen. The spleen should not be palpable, not be percussible. And then I'm going to do the same here, going from an area of resonance, which is the lungs, to an area of dullness, and then back to resonance so that I can percuss the liver borders. And this is where the end of the liver border is. We'll go ahead and palpate. Go ahead and take a breath, Faith. Hold it for me. Breathe. And then from the fifth to sixth intercostal space to where I heard the sound tipping it again is approximately 10 centimeters. Normal, where the liver border is, normal is 7 to 10, so that's she does not have an enlarged liver. And then we'll do light palpation all over. We're looking for masses, any abnormal growths that may not have been found any other way. You do that on both, and then we'll do deep palpation, which is a little firmer, a little deeper. That way, if we didn't find masses on the light palpation, we might find them on deep palpation. We would do that all over. And then we're going to palpate for on the right upper quadrant, right under the sternal angle, the costal vertebral sternal angle. We're going to palpate for the spleen. If you'll take a deep breath and blow it out for me. Deep breath. One more deep breath. Okay. And the spleen is not palpable. Go ahead and take a breath. And then go ahead, take your breath and hold it. And the liver border is right over here. You can feel it. Go ahead and take a breath. Lift your head up for me. There are no visible areas where I see any outpouching or hernias that may not have been visible any other way. I'll go ahead and palpate and see if I can feel for the kidneys, but they're usually not palpable. And again, this was a normal finding. They were not palpable on either side. Go ahead and sit up for me. We'll move on to the musculoskeletal system. And we're going to test first for the sternocleidomastoid muscle strength. Try to keep me from pushing your head forward and keep me from pushing your head back and from side to side. Okay, and that feels normal. I would grade that a 5+. Next, with the temporomandibular joint, go ahead and we'll palpate it, and I don't feel any abnormal findings here. Go ahead and open your jaw and close your jaw, and then do side to side. Okay, and then do like a bulldog, and then back in, and then clench your teeth. And then this is testing for cranial nerve 5. Inspection of the anterior chest wall reveals a normal venous pattern. The skin appears to be intact. There are no scars. Excuse me. There are no outgrowths. The skin is pink. Posterior wall, the skin is pink. There are no scars or abnormal protrusions or outgrowths. And go ahead and shrug your shoulders for me. Go ahead and shrug them and try to keep me from pushing them down. You can go ahead and relax. That's testing for cranial nerve 11. And then on palpation, the muscles feel warm. They feel even. There are no boggy areas. They don't feel like there are any areas that are hard or knotted. On the bilaterally, we would do this on bilaterally, but for purposes today, we're just going to do the right wrist, and we're going to feel all the joints in there, looking for any growths or any areas of inflammation, edema. We would look for any growths, nodules that might lead us to believe that she may have rheumatoid arthritis. And we'll go ahead and test while we're down here muscle strength of the thumb. Go ahead and try to keep me from pushing it out and pushing it in. And then put these fingers together here. Try to keep me from pulling them apart. And do the same for the next set. And do the next set. And do the next set. Okay. And try to keep me from pushing your hand out. Try to keep me from pushing your hand in. And try to keep me from pushing your hand down. And try to keep me from pushing your hand up. And then we're going to go ahead and shake my hand. Squeeze. Okay. Squeeze my fingers. Okay. And then we're going to test the ulnar side for the median nerve, the radial side for the median nerve, and then we're going to get you to flex your fingers down, make a fist, that's good, flex them down, extend, and then hyperextend, and then hyperextend the wrist, extend the wrist, flex the wrist, and then we're going to feel the epicondyle, ulnar epicondyle. You're going to feel this muscle down the ulnar side. And then go ahead and put your hand in a neutral position and go ahead and put it down. That's pronation, and put it up, supination. And then we're going to put your elbow right next to you, and we're going to medially rotate, laterally rotate. And then I want you to put your shoulder up, and we're going to externally rotate, internally rotate. And then we're going to abduct the arm, which is adding to the body, which is with a D. And then we're going to abduct, which is with a B. And if you'll do me a favor, extend that arm all the way up. And then put it back down. And the knees, they looking straight onto them. They are at the same height. There doesn't appear to be any bulges. The skin is warm on palpation. There are no nodules, or is there any pain there?
No.
Okay. And if you'll do me a favor and try to push with this hand, push, and then try to keep me from pushing it down, try to keep me from pushing it up, keep me from pushing it out, and keep me from pushing it in. And we're just going to inspect the foot, make sure there are no outgrowths or pain or nodules here. There are 5 digits on both feet. We're going to flex the toes. We're going to extend the toes, hyperextend the toes. And do me a favor and push on the gas. And then pull back up like you're taking your foot off the gas. That's plantar flexion and dorsiflexion. And do me a favor, turn your leg inside, turn your foot outside. That's eversion and inversion, and those feel fine. Try to make it where I can't push your foot down, your leg down, and then try to make it where I can push your leg down, out, and in. Okay, if you'll lay back for me. Okay. And we're going to, I'm just going to passively do this. I'm going to flex the leg all the way in. Is there any pain there? Okay. And then we're going to abduct the leg. Is there any pain with that? Again, there's no outpouching or fluid around the knee. The muscles still feel firm. The iliac crest of the sacrum are symmetric and in line. Last thing, we're going to do this. Tell me if there's any pain. No? Okay. Well, Miss Mitchell, I need you to bend forward. I'm sorry. And then bend back. Okay. And then side to side. Okay. Do you have any pain with that?
No.
Okay. All right. Well, let me know if you have any questions, and I'll let you know if we need anything else from you. Okay.
All right. Thank you.